This is from an article in the Palm Beach Post. It's a forum on the Florida Shuffle highlights failed addiction treatments. It's printed January 19th, 2024. Relapse Pays. Local forum tackles drug addiction treatment and the Florida Shuffle. Drug addiction is a disease that takes hundreds of lives in Palm Beach County every year. It is often misunderstood and mistreated. That's slowly changing, but experts say much is yet to be done. And private treatment facilities can make false promises and reap insurance payments for substandard treatment of people in crisis, a system that prospers under lacking oversight by the Florida Department of Children and Families, a recent Palm Beach Post investigation found. And other resources that should be a source of help, such as hospitals, first responders, and even friends and loved ones, are often behind the curve on the kind of care and empathy needed to help someone struggling with addiction, a group of 4 experts said on Wednesday evening. Impact from Post investigation, help coming on addiction treatment centers. They gathered at the Palm Beach State College campus in suburban Lake Worth for a community forum called Fixing the Florida Shuffle, Next Steps, moderated by investigative reporter Antigone Barton and sponsored by the Post, the college, and the Hanley Foundation. The forum continued a conversation about failings in the treatment industry. It also highlighted opportunities to address a problem that takes thousands of lives throughout Florida every year, each of them a beloved friend, family member, or spouse. That includes Joseph Havrilla, who traveled to Florida and repeatedly sought help before an overdose took his life in 2020. His girlfriend, Amanda Davidson, is now continuing her own recovery and advocating for a life-saving care in the state that failed her and Havrilla. He was more than what he died because of and deserved help, Davidson said. So many other people deserve help because the potential they represent in those numbers will never be realized. And we would be a better community if they had been. To watch the full 2-hour conversation, visit YouTube/at Palm Beach Post and click the Live tab. And you can read the Post investigation, The Florida Shuffle. State's failure to oversee addiction treatment leaves patients in deadly danger. Drug addiction is a disease, not a choice, experts say at the Florida Shuffle Forum. In Florida, some bad faith treatment facilities offer hope and promises of a quick recovery in the beautiful Sunshine State. But that's not how drug addiction works, says Dr. Robert Morin, a psychiatrist, addiction medicine specialist, treatment center owner, and member of the local addiction recovery task force. Gone are the days of Nancy Reagan's 1980s Just Say No campaign, which assumed that people were making a choice to use drugs despite the negative consequences and that people could simply choose to stop, Morin said. Decades of new research have made it clear that drug addiction changes the physical makeup of the brain and affects people's ability to make sound decisions, regulate emotions, and fully understand the impact of their choices. There is no doubt that addiction is a brain disease, he continued. We've known it for 20 years, and it's agreed upon by multiple organizations in the field. Well, this is not quite up to date because it is from Florida, so I'm sorry about that, but I'll continue reading anyway. We actually understand it more now as a learning disorder. Florida will take probably another 10 years to catch up to that one. Much like another disease, addiction requires proven medicines, therapies, and social services. The care of a medical provider, whether it be intensive care or the occasional checkup, is needed throughout the lifelong process of treating addiction. Such evidence-based care is required but not enforced, Morin says. That's largely because Florida is one of the states to assign licensing of the industry to an agency with no medical expertise. the Department of Children and Families. I had an audit in my facility, Moran said, and the auditor from the DCF said, who is not medically trained, asked me the question, do you utilize evidence-based practice? I said yes, and she checked the box. Well, that's horrible. Problems fueled by stigma and poor oversight by the Department of Children and Families, who do also run our overdose prevention program. Alan Johnson, the Palm Beach County's Chief Assistant State Attorney and head of the office's Addiction Recovery Task Force, has met countless people who travel to Florida after seeing flashy advertisements for palm trees, sandy beaches, and resort-style recovery centers. And all too often they arrive to gloomy facilities where large groups of people are given little to no help before being released shortly after, leading them to relapse, and if they do survive, to return and generate more insurance payments for an endless cycle of drug testing and non-existent treatments. That cycle is known as the Florida Shuffle. Relapse pays, Johnson says, and that's why local investigators have been working for years to crack down on suspect treatment facilities, especially with the introduction of fentanyl, an incredibly deadly substance, into many street drugs. It's a long haul, Johnson continued, and I think we're moving in that direction with what we're doing in Palm Beach County. We've got headwinds, but we're moving. Another issue is the judgment surrounding drug addiction and treatment, the expert said at Wednesday's forum. When someone is in crisis, desperate for help, they might instead find a nurse or police officer who sees addiction as being different than other health emergencies. Dr. Bima Endrick, Chief Medical Officer for the Healthcare District of Palm Beach County, gave the example of a young person visiting the hospital for repeated heart attacks. You wouldn't leave that emergency room until 5 doctors come and talk to you and connect you with services or airlift you to a higher level of care because you almost died 5 times, she said. If you have a 23-year-old coming in for the 5th time overdosing in an emergency room, it's very normalized. As a medical society, we don't even have the same urgency or acuity around this illness. Expert talk solutions to tackle drug deaths in Palm Beach County. Experts at Wednesday's community forum said education was key to removing the stigma around drug addiction and treatment, including medications such as Suboxone, which helps to block withdrawal symptoms and opioid cravings. I take Suboxone, which is hard to say because there's a lot of stigma, even within the treatment community and the recovery community, that calls them not even sober. And I can tell you I'm doing a lot better now than I was a year ago when I was trying to be sober without it, Davidson said. Education also includes efforts to help medical professionals, family members, and others to understand the changed brain that leads someone to act irrationally while battling drug addiction, Moran says. They're recognizing that when their loved one is ill, they're talking to the illness, he said. They're not talking to their loved one. I often think that when I fall into the trap myself, when I'm talking to a patient and the patient is getting me upset and I'm realizing, wait, I'm not talking to the patient, I'm talking to the illness. Another vital step to ensuring that treatment facilities are actually using evidence-based practices and actually hiring people who specialize in psychiatry and addiction. DCF, along with the insurance companies that fuel sham treatment facilities, should do a better job of verifying that proven methods are actually being used, Moran continued. The healthcare district started to bring that knowledge and understanding to Palm Beach County by establishing the Addiction Stabilization Unit at JFK North Medical Center in West Palm Beach several years ago. And now Andrick says her organization is partnering with other local groups to establish a new system of care that supports people battling addiction at every stage of recovery. That includes the creation of mobile crisis units that can respond to people who need the immediate help of a knowledgeable and understanding person. The Post's investigative reporting also sparked new legislation that demands more transparency from the Department of Children and Families. DCF Secretary Siobhan Harris has since assured one of the bill sponsors that her organization would begin to voluntarily post inspections, complaints, and investigative reports online for the public to see. Oh, well, that's nice now, finally, huh? And regardless of the solution, the people most affected, those struggling with addiction, should be included in the conversation about how to tackle such a wide-reaching and devastating problem, Davidson said. Well, that makes sense, and that must explain partly of why those of us who have been volunteering for years under the Florida overdose prevention program, that they even told us to not even tell the public that we were associated with the Florida Department of Family and Children, who runs the very program that we were volunteering for. Come to find out, they were much more complicit in the negligence in this state than I ever even realized.